Hello and welcome to this telemedicine remote blood check analysis presentation. This is in the context of human factor and artificial intelligence. There will be some privacy and ethical consideration. This is obviously a fictive use case. I urge you to search the advice of an expert. The first thing is the task analysis and the problem description. Many elderly individuals require regular blood checks to monitor their health. And obviously, especially in big city, uh, they have mobility issues, and make frequent visit to the doctor is challenging or even impossible. This can lead to delayed diagnosis and treatment, impacting their overall well-being. This is obviously a generic use case. The key task, the primary task, is to enable the elderly user to perform blood tests at home and receive personalized medical recommendation through a remote system. The basic task analysis that follows is, for number one, user collects a blood sample using a home device. The device analyzes the sample and sends data to a remote server automatically. And a machine learning and AI algorithm will process the data, and the user receives personalized medical recommendations via an app or a web interface. Insight for simplifying the task flow, the user-friendliness of the device is obviously one of the most important things. Design an intuitive blood collective device with clear instructions. Automated data transmission ensures that the device automatically sends data to the server without requiring user intervention. A simple interface develop a user-friendly app with easy navigation and clear instruction. Support system obviously provide customer support to assist user with any issue they may encounter, and education provide a home educational session for the customers so that they learn how to correctly use the device and interpret the results of the device itself. For the user experience design, the user interaction is about first the blood collection. User collect a blood sample using this device. The data transmission happen automatically from the data to the server, and the result delivery is just automated with the recommendation. Some key consideration, first of all, user input and feedback loops. The input, the blood sample, user health data. This is obviously optional. The feedback, immediate confirmation of data received, progress update, and final result. Final result. Transparency of the model. It needs to be explained how the AI model works in simple terms and provide information on data usage and processing and communicate uncertainty. Obviously, like every machine learning algorithm, this has some limitation and there is a level of percentage of confidence. So clearly communicate the confidence level of the recommendation and provide guidance on what to do if the results are uncertain or require further medical consultation. Obviously, this kind of result is only indicative. It doesn't substitute the um, check from a real doctor, of course. Privacy consideration. Privacy concern are the data sensitivity. Blood test results are highly sensitive and require strict privacy measures. Data minimization, only collect and process the minimum amount of personal data necessary for the diagnosis. Data security, implement robust security measures to protect data from unauthorized access, breaches, and leaks. This includes encryption during transmission and storage, so data in transmission and at rest. Clearly inform the patient about what data is being collected, how it will be used, and who will have access to it. This is under transparency. And obviously, there is the explicit consent to obtain explicit consent from patient before collecting and using their data. Ensure that patients understand their rights and how their data will be used. Applicable privacy laws are the GDPR in Europe, and remember that since 2020 for UK there is a separate version of this law. Requires explicit consent for data collection and processing, data minimization, and the right to withdraw consent and deletion of the data if the user requires it. Since we are talking about medical data, obviously the IPAA for US if this is going to be rolled out in the United States. Obligations obtain explicit informed consent from users and store it obviously for the discussion. Implement strong data encryption in transit, in memory, and at rest, and access controls multi-factor, for example, authentication at zero trust authenticate every time. Provide user with the ability to access, correct, and delete their data, establish clear policy and procedure for data handling, including data retention, access control, and audit trails. Ethical consideration at the last slide, but obviously not the less important. Potential sources of bias, ensure diverse and represent data to avoid biases in the AI model. Algorithmic bias, regularly audit and update the AI model to prevent biases and discriminated based on race, gender, age, or other factors. Meeting the ideal AI goals, the first point is fairness. Use diverse dataset to train the AI model and regularly test the model for biases and correct them if found. Accountability, maintain transparency about how the AI model works and its decision-making process. Provide a clear process for users to report issues or concern. Professional integrity, healthcare providers should maintain their professional integrity and not rely solely on AI for medical decision. Obviously, we are talking about augmentation and not replacement of a human uh, healthcare provider. Transparency, clear communicate how data is used and processed, provide the user with access to their data, ability to understand the AI generated recommendation, how the AI algorithm reached to its conclusion, and provide the ability to question or challenge its conclusion, of course. Inclusiveness, ensure that the benefits of AI medical diagnosis are accessible to all patients, regardless of their socioeconomic status, geographic location, or other barriers. Accountability, establish a clear lines of accountability for the outcomes of the AI system. That's all. Thank you for your time and take care.